We've had a few of these records broken already in terms of the nurses coming out, because they've never been on strike before until December last year, and that's a first. And now we have the nurses and the ambulance crews going out at the same time, which in terms of numbers and in terms of percentages of NHS, National Health Service trusts around the country is the biggest ever. 73 different NHS trusts involved in this, 50,000 appointments cancelled, 13,000 ambulances off the road for a day at least, but the nurses are striking for 2 days, and it's just a sign that their positions are not moving at all. The public sector workers are digging their heels in. Their unions are saying, do not accept anything other than what we're negotiating on your behalf for. The government is still not bringing its attention to bear in terms of negotiations. It's almost turning a blind eye. It's saying that these people are irresponsible, that they're letting the country down, and we're not going to respond to this kind of blackmail. And they're saying we'd love to give them a pay rise. The Prime Minister himself has said that, but we don't have the money for it, so it's not going to happen. But what's interesting is, 2 months into this industrial action now, let's take a little glimpse at the front line of these picket lines. The energy's still there.
Not listening. They're still saying, you know, the NHS doesn't have the money to pay. Of course the NHS doesn't have the money. That's why we're here. We're here for everyone. The government needs to listen and discuss pay rather than just saying the NHS doesn't have money.
We're going to find it harder and harder to recruit, harder and harder to retain staff. A lot of people have left the profession already because they're so disillusioned. I think we've got to look at the future, and that's what this is all about. Actually, it's not about the present so much, it's about the future as well.
They haven't come up with anything clever so far, and of course it's not far away now, 2024, possibly the end of another general election on the horizon. So it's time to stand up and be counted. But at the moment, the nurses, the ambulance drivers, the teachers, the rail workers are all doing their bit and sticking to their lines.